wanted to be a Navy SEAL.
Yeah, like you said, I mean, none of us really, I think this profession chooses us, right? Like we don't
Yes.
really choose the profession, it finds us.
Yes.
Because that was the original plan, when I was a teenager. I was just trying to figure out life like any teenager, but I was always very motivated, always had the discipline, the work ethic. And I wanted to be kind of a real life superhero and do something impactful. And so Navy SEALs was literally
I was going to say, that's pretty superhero-ish.
Yes. Dr. Mindy in the house. All right.
I appreciate that.
The carnivore diet.
Because of what we eat.
Honestly, you've really touched my heart.
So Fast Like a Girl, it's ready for pre-order now. I hope this book changes your life the way the information has changed hundreds of thousands of women that have applied it. From the bottom of my heart, enjoy and let's get healthy together.
And this always fascinates me about people who are in the functional health world, is that many of us never intended to be in this functional health environment that we're in. And you are definitely one of those people. But when I went back and looked at your story, you wanted to be a Navy SEAL.
Yeah, like you said, I mean, none of us really, I think this profession chooses us, right? Like we don't really choose the profession, it finds us.
Yes.
Because that was the original plan, when I was a teenager. I was just trying to figure out life like any teenager, but I was always very motivated, always had the discipline, the work ethic. And I wanted to be kind of a real life superhero and do something impactful. And so Navy SEALs was literally
I was going to say, that's pretty superhero-ish.
Yeah. In my simple little teenage brain, that was the best thing. And so I did go for it. And, I think the universe works in mysterious ways. And I don't think that was the right path for me. And so I was actually medically discharged while I was in training for the SEAL pipeline. They found I had an inguinal hernia. So they gave me a medical discharge. And I actually spent about a year trying to get back into the program. And honestly, I started struggling so much with depression and a lack of purpose. And I needed to start moving on. And so that's when I became certified as personal trainer and nutritionist and jumped into that world. And I fell in love with the work, and that just evolved over time. And here we are like 11 years later. So it's been quite the ride.
Yeah, we call it a pain to purpose story. It's like when you hit your own blocks with your health, what I've noticed the commonality of a lot of people who are out in the social media world educating is that you become obsessed with putting your own puzzle back together again. And there's one of the things I want to dive into with you is like, we have this huge gap between like somebody who's struggling and their solution. And it used to be in the olden days, if you struggled, you just went to the doctor, you got the solution, and you were not struggling anymore. But that's not happening. Like people are struggling and they go to the doctor, and the doctor gives them bad information or wrong or ineffective information. And then what are they left to do? So how did you go from a place of like, hey, I'm struggling, my health isn't great, now I need to find my own path? What did that journey look like?
Yeah, for me, it was, I was struggling with what was at the time basically undiagnosed major depressive disorder and ADHD, which I was actually diagnosed with at the age of 21. And, I'd been thrown a few different prescriptions like Zoloft and Wellbutrin, Vyvanse, Adderall, all these cocktails. And certainly to your point, it is a very incomplete healthcare model, right? And the more I learn about pharmaceutical science, the more it amazes me. But unfortunately, we have this kind of archaic, dogmatic, incomplete system of, well, there's either nothing wrong with you or here's your drug. And I don't know, we've strayed so far from what I think medicine, the practice of the medicine was always supposed to be and what it always was. And I think there's kind of this bastardization of big pharma. So honestly, helping myself wasn't as much what steered me into the functional medicine world, because I was a fitness trainer and nutrition coach, and I was pretty happy just guiding clients back to health. And the beginning of my career, I was introduced to lab testing and metabolic testing, VO2, all the fancy data to guide that health building process. But it actually wasn't until my ex-fiance got really, really, really sick. That's really what inspired me to get more into the functional medicine space, because she very acutely came down with this, mysterious illness. Nobody could figure it out. Ice pick musculoskeletal pain, kind of fibromyalgia, chronic fatigue, debilitating cognitive dissonance. And we had no idea. I had no idea what was going on. We went straight to the doctor, chiropractor, tried to do naturopath, couldn't afford it. The whole spiel that so many of us go through. And that got me introduced to MTHFR and then methylation and mold and all these things. And that it was really trying to kind of save her. That's what steered me into this industry.
What, just on that note, what was it, a chemical overload for her, or was there one specific thing that was taking her down?
I am convinced to this day that it had to have been mold. I wasn't exposed to the science of mold illness until probably 3 years after the relationship ended and we had been separated. And honestly, it's really tragic to report. I'll never get the opportunity because she just took her life actually 2 months ago. So
oh my gosh.
I never, got the opportunity to confirm. But that's what really sparked my interest in mold and methylation. Was I was convinced the symptomology, the musty environment, the water damage to the home. So I think it was a lot of compounding factors, as it always is. But I am still convinced that must have been the main thing.
Wow. Mold is so interesting. And this is, again, you and I talked before we started recording. This is one of the major reasons I wanted to bring you on. You posted something on Instagram that caught my attention literally at like 9 o'clock at night as I was like scrolling through Instagram. And what you said was, and I'm paraphrasing, but it was something along the lines of like, I didn't set out to study mold toxicity. That was not your passion. But now I understand deeper that there was a motivation behind how when somebody is affected by mold, it just takes over their brain. And I cannot help but think, when I'm so sorry to hear about her taking her life, because I see with our patients who have mold, it's like their thinking is so dark, and they can't get out of the negative spiral that they are in. Is that where she was at?
Absolutely. I mean, it's been several years since I've communicated at all with her, but the last time I did, she was still in horrible agony, the musculoskeletal pain, the cognitive debilitation, and a single mom with 3 kids. Like it was hard, and especially when you have no answers and conventional medicine says it's all in your head. So mold has, like my post kind of alluded to, I never would have thought mold would be such a big part of my professional life. And, I will preface by saying, I think there's a lot of sensationalism in our industry. So I don't want to sensationalize mold, but I will say, like, when it's there, when it's relevant, when it's on the radar, it's crippling. And that's probably one of the most devastating and hardest things about working with mold, or for somebody struggling with mold related illness, is it does. You look at the science of how the mycotoxins interrupt our nervous system and basically every facet of our physiology. And they are kind of going crazy. It causes apoptosis in neurons. So it's very difficult to navigate because they don't know why they feel the way they feel. And it's that combination of all the psychology, physiology, but mold can be a major culprit for any kind of neurological issue.
Yeah, it's so interesting because what I see today, especially in our younger generation, is we've got this epidemic, or I should call it like a pandemic. It's like, how many pandemics do we have going on this year? There's more than just the one everybody's talking about. But we have a pandemic of brain dysfunction. And we look at these kids, like I have a 20-year-old and an 18-year-old, And the first time I heard that they had friends that couldn't go to school anymore because their anxiety was so high, I was like, what? Like, what are you talking about? Like, you just buck up and go. But when you have toxicity to your brain, there's no bucking up and going. There, it is totally enabling. And mold is definitely in there. Do you feel like there are other toxins that are just totally swarming our brains right now? And I don't even think it's just the youth. I think it's happening to all of us.
Mm-hmm. Yeah, it's such a compilation of so many factors. And, so that's where it's interesting. You look at all the different mental health and neuroscience research where, there's kind of the more classic monoamine theory of depression. And that's where all the SSRIs and reuptake inhibitors, more looking at just the neurochemical signaling. But now what we really understand is, well, cognitive dissonance, whether it's depression, anxiety, or anything in between, is primarily inflammatory driven. So then it kind of changes that equation where actually interleukin-6 antibody drugs are in phase 2 clinical trials as kind of a new era of antidepressant drugs for treatment-resistant depression and mental illness. So then you start looking at all these different factors that are driving inflammation in the American population. So obviously our environment increasingly toxic and all the EMF and our poor lifestyle habits, but then you sprinkle in some of these major neurological disruptors, which I generally find to either be a bug or a toxin that's really driving that inflammation. So I think the heavy metals, I think the microbiome disturbances or any kind of mold or stealth infection, I find those to be the biggest offenders when it comes to causing that cytokine storm that disrupts our nervous system.
Yeah, and then once you're in it, you know, how do you get out of it? And you talk a lot about how labs today in the doctor's offices, your traditional doctor's office, are not helpful, and that we need to be looking more at functional labs. Now, I could be paraphrasing you. This is what I saw in some of the things, and I think it's really true, because I don't know if you see this, and I know you teach doctors, that's sort of your path, but you know, I see this with patients a lot where they are experiencing brain fog, anxiety, depression. They go to the doctors. The doctor either doesn't run a test on them or runs a test that says they're good, they're normal, puts them on a medication and says, just take this and you'll be fine. And then they're left in this spiral of confusion. How do we help those people? How do we reach those people? Which is really what I'm trying to do with all my social media, is like, let me get to that person that is struggling and let's give them other answers.
Mm-hmm. Yeah, there's so much to be said for just providing answers to those that have lost their hope and lost their faith. I mean, even just the emotion that hope can induce, like that's healing in itself.
Yeah.
But to your point, you know, certainly I do think good old-fashioned blood chemistry is the most reliable test we have, but obviously the way conventional versus functional interprets that is very different. Mm-hmm. But even still, I literally just got done consulting with the practitioner, and it was a mold case, and she did have just a standard blood chemistry done through her doctor, and then a urinary organic acid test. And you know, certainly I think we have to always be questioning the efficacy of some of these functional tests so we don't waste money or
there's
use the
so
technology.
Many of them.
Right.
There's like so many you could do.
Absolutely. And they're popping up overnight, you know, new technology every day. And, you know, so I think we have to be responsible consumers of functional lab testing, but you know, the point where this blood chemistry I was just looking at, even through the functional lens, like it looked pretty squeaky clean overall, but then the organic acid just lit up with fungal metabolites and toxicity and all these things that directly correlated with the symptoms and the health history. So yeah, sometimes those functional tests are going to be really what provide that aha and provide a spark of hope that then we can act upon.
Mm-hmm. Are there things, just so we can give people some really good solid resources, like could somebody, if they thought they had brain inflammation and it was because of an infection or it was because of a toxin, could they literally leave this podcast and go and pick up their last blood test from their traditional doctor and look for different categories that would give them an indication that they have an infection or a toxicity that their medical doctor might not be trained to see.
Yeah, I think so. Absolutely. You know, I think I like that phrase that we've come up with in our industry of stealth infection, because I do think, you know, with our newer understanding of the microbiome, or really our infants but evolving understanding of the microbiome, you know, we can really see it's like, well, any kind of microbiome disturbance can cause a lot of, you know, chronic underlying inflammation, even if like it's not that acute infection where white blood cells are at 15 or 20 and so on and so forth. So even just on that standard blood chemistry, things like homocysteine or uric acid or those liver enzymes, it can be subtle with the different patterns. And that's where some of these additional biomarkers like the TGF-beta1 or MMP9 or some of these other biomarkers, neoterin is a great one as well, that we can be requesting from our doctors or looking into. Because sometimes that standard comprehensive metabolic panel or CBC looks pretty flawless, but when you start looking at the breakdown of the white blood cells in conjunction with different inflammatory patterns, you know, C-reactive protein is the most popular, famous,
Yeah.
but even that, I mean, acute, it only has a half-life of like 50 hours, something like that, pretty short. So I think we have to use some of these other markers to really form a solid pattern that indicates something else is going on.
Yeah, yeah. And educate people that just because your doctor said you're good and you're feeling bad, you may not be good. Like
Right.
that's a really, like, that shift, that paradigm shift, I think just that alone needs to happen for people. So
Absolutely.
when you look at like co-infections, toxins, EMFs, and they're all like mixed together, how do we start to unravel? Like, so some of the people that we see in our clinic are people who literally have, you know, Lyme, mold, candida, parasites, heavy metals, and Wi-Fi intolerance. Like, these people are just reacting to everything. When you look at all the toxins affecting the brain right now, what do you think is the most impactful? Like, is there one that if we remove this one, the body can take care of the rest? Or is it more of like a stepped approach that people should have?
That's a really good question. And I think there's kind of two sides of it. I do think at times we have to really try to identify what seems to be the main culprit, because I think that's the beauty of kind of the more functional holistic approach is we're kind of working on everything at the same time, right?
Yeah.
It's very different than, you know, well, this particular drug, which is very specific in its mechanism of action, whereas obviously, you know, if we're working through our full intervention spectrum and using our environmental intervention, the lifestyle, psychological, supplemental, you know, we don't have to be as kind of sniper and this is the one thing that we're targeting. Because I do think, I always like to think kind of the big kahuna versus the low hanging fruit. You know, I think the more we can kind of pick that low hanging fruit, you know, we teach them how to swap out their toxic cleaning chemicals and whatnot, or turn off their Wi-Fi router at night. There's just those little things that we can do to lessen the burden of all those harmful input signals. But at the same time, I have also had cases or consulted on cases where sometimes we're almost getting too distracted by all the many things that we could be doing, when in reality, maybe like if, you know, they do have a mold infection or something, that antifungal drug could make more progress in 2 weeks than all that holistic stuff could for months and months. So I think it's kind of a balancing act of not creating a problem where there isn't one, but not overlooking a healing opportunity where there is one. And so using an assortment of labs, but also that's why I'm so big on blood work and organic acids and whatnot, of, you know, a lot of these different infections or toxins, they will sort of self-resolve if we're working holistically, supporting the immune system, the detox pathways, and using the full intervention spectrum with our modality.
I agree. And I feel like my training has always been around the body's intelligent, it can heal itself. And then you start to, you know, meet these people who are like eating right, they're exercising, they're trying to sleep, and they're technically doing all the right things, and they're not healing. Do you feel like the innate intelligence of the body is under attack right now, for all of us?
Yeah, I very much agree with you. I think we're kind of de-evolving. Honestly, we're finding the technological means to kind of perpetuate our own toxic behaviors and toxic lifestyle behaviors. And that's, like I was just attending an awesome conference all about mold this past weekend. And that was kind of a big theme of the drug resistance of like, well, if somebody has a mold infection or whatever, you can clear that out with these drugs. But what about when it comes back, or the microbes are becoming increasingly resistant, and we're increasing the toxicity of our environment, increasing the EMF and radiation. So I think our physiology as a collective is just really under attack from all angles,
Yeah.
which is why I hope, it's early to say, I hope that the events of this year wake us up.
I hope so too.
I guess
Yeah.
we'll see.
Yeah. I've been since the beginning of March, and I've had a lot of people on my podcast, really intelligent people chatting about this. The one question I keep asking over and over and over again, and it doesn't seem that our politicians are talking about it, that the general community is talking about it. And the question is, why is everybody so immune compromised?
Mm-hmm.
And that we have to look at that. Like, so early on, I interviewed, Dr. Zach Bush?
I do. I'm a
Yeah.
big fan. Yeah.
Amazing human, right? And he's so smart. Like when you hear him talk, you're just like, wow. So we caught him early in the pandemic. He was in Fiji, and I asked him to come on and let's have a chat for my community about like where did this virus come from? And he, of course, an hour later had it all mapped out exactly where the virus came from. But what I took from it is it's a new virus, and our immune systems haven't recognized it. And so our best bet is to keep the immune system strong so that we can be able to create a proper immune response to this virus. Makes perfect sense to me. But yet we're just in viral avoidance. We're just all about viral avoidance for the last 6 months. There's no hardcore, how do we start to support our immune system? So when you look at things like, let's just start off with mold, and then I want to talk about Wi-Fi and EMFs as well. What do you think mold is doing to the average person? And one of the questions I've had about mold all the time is like, how come you can take a family and they can have mold in a house, and 2 of the people in the house are sick and 2 don't notice anything at all?
Mm-hmm. Yeah. So, this will be fun to unpack. I love Dr. Zach Bush's work and what he mapped out with the virus coming out of the highly toxic Wuhan province, and his theory, I suppose, which I think is pretty strong theory.
Yeah, it's pretty strong.
Basically an extinction crisis causing Mother Nature to create this de novo virus where the planet is being stressed the most, and how New York City is kind of the closest environment we have in the States compared to China and whatnot. So I think he's really onto something there, and I love the glyphosate impact that he talks about as well, because I think in between the metabolic syndrome that's just 88% prevalent
right.
in our
12%
country.
of the people in our country are metabolically fit. I'm like, why aren't we talking about this?
Yeah, exactly. So with half the population diabetic, 70% overweight or obese, 88% metabolically ill, that right there is enough to be immune compromised. But then you throw the glyphosate and then the EMF. And so with mold, again, I don't think mold is affecting everyone, but I do think it's more common than people realize. And what really breaks my heart is mold is becoming trendy and popular in our world. But think about how many, thousands or millions of people are living around the world in these, old inner city, broken down apartments that are just water damaged horribly, or office buildings, government buildings with their flat top roof and all these things. I do think mold is kind of this silent brewing disaster, and it's so detrimental. I mean, we all know about mold, but I don't think we realize how common it is, how prevalent, or more so just how detrimental it is. You know, as soon as it's remediated or people just wipe it away, it's kind of out of sight, out of mind. But as far as, you know, because that was me with my ex-fiance and her children, 5 of us living in one house. Whereas, you know, my ex-fiance was kind of the canary that just got crippled. Whereas, you know, her son, it presented as this more kind of allergic sinusitis. And for me, it was chronic fatigue and a flare-up of my depression and kind of ADHD. So assuming that it was mold, which I technically don't know, but it can affect everybody in the family differently. And primarily that's going to be the genetic polymorphisms and, you know, the unique genetics of each individual and how robust is their, you know, metabolic resilience. But those canaries, the ones that get really sick, which from an evolutionary perspective is an advantage. You know, if you have your hunter-gatherer tribe living in a moldy, toxic environment and only one of them gets sick, hey, that's the canary that then tells the rest of the tribe, like, this is not a safe environment. We better get out of here.
That's a great way to look at it.
Yeah, so there is that evolutionary benefit, but it sucks to be the canary. And so those are the ones with like the HLA phenotypes that they don't have that MHC1 complex to, you know, signal to the lymphocytes like, hey, we got to do something about this pathogen here. So they're the ones that generally get very, very sick.
What are the classic symptoms of mold? Again, just so as people are listening, because like to your point, I don't think it's not their go-to toxin. You know, they're like, and I'm sure you hear this all the time. I hear people say, when I say, oh, do you have any water damage in their house? And they're like, well, there's this like black stuff in my shower and I just wipe it down, it goes away, and then it comes back. So what would be like classic symptoms somebody has mold?
Absolutely. So I think it kind of depends on, there's a lot of factors to mold, but I think kind of the 2 main categories we can simplify are, do they actually have a mold infection, like a mold colonization? The mold has actually overgrown within their body. You know, we talk so much about candida and candidiasis of like, well, candida is just a commensal yeast. And, you know, if you have an unhealthy microbiome, you're stressed out or immunocompromised, it might flare up. It might opportunistically overgrow. I don't think mold and aspergillus or any of the other species are really that much different. But then if we are being exposed in the environment and breathing in spores and breathing in the gases and the mycotoxins, it can really just compound that effect. But then there's the toxins themselves. But as far as symptoms, these toxins can affect virtually any tissue. I mean, it causes a lot of liver damage, kidney damage, it kills neurons, it kills basically every cell, and they're ionospheric, so they can move in and out of cells very easily. So, you know, I think some of the most pronounced symptoms, brain fog is a big one. Like really pronounced brain fog, that could definitely be like a fungal overgrowth or the subsequent toxicity. But some of the more unique characteristics of like the mycotoxicosis or the SIRS or the mold toxicity, shall we say, I think like the ice pick stabbing pain, the neurological symptoms, the depression, severe musculoskeletal pain, a lot of like severe inflammation symptoms, because that's really what's going on. So if they do have more of a colonization, which generally is in their gut, but it could be the sinuses or elsewhere, but the gut is kind of the main hub, they might have, you know, SIBO type symptoms, and despite, you know, just abdominal bloating and distension and, you know, more GI related symptoms, but the toxins can cause crazy systemic symptoms as well, whereas others might have more of an allergy. So I think that's part of what makes mold so tricky, is there's such a broad way that it can present. But I would say fibromyalgia, chronic fatigue, and brain fog would kind of be like my top 3 that I'm immediately thinking about, at least digging into the possibility of if it's on the table.
Yeah, yeah. And what do you think the mold that we get, like, so we do run mycotoxin tests on people. We do a Vibrant Wellness mycotoxin when we suspect mold. We don't, it's not our big thing. We do a lot of heavy metal detoxing, and we actually find when you remove the heavy metals that a lot of this stuff clears up, but except mold. We find mold is like that stubborn thing you got to go after. And when I get a mycotoxins report back, what I find is that there's sort of two categories. There's the mold you get inside a building, like a black mold, and then there's the mold on your food. Do you think that those two molds will act, do they have the same intensity in the body? My hunch is the home mold is a lot more detrimental than the stuff on the food, but I may be wrong on that. I'm curious your thoughts.
Yeah, no, that's a really good question. I definitely find that the water damage building or something like an aspergillus colonization in the body tends to be more severe and a little bit more problematic. I don't find dietary to be as big of a concern.
Yeah.
But it depends too. Like Fusarium is the species of mold that is more commonly contaminated in like our corn products and our grains and all of that. And so some of those mycotoxins might be contaminating some of our food but you think about like you buy organic blueberries, at the store, and then maybe the next morning they're like covered in mold. And it's like, well, especially organic produce that's in the natural environment, doesn't have all the fungicides, herbicides. It might have mold spores or some mold cells on it, and it's the perfect food source of sugar. So we're going to consume mold and mold spores and mycotoxins just as part of being human. We've evolved that way. So I do think the dietary side is relevant. For example, what is it, number 9 on the Vibrant or Great Plains organic acid test, which is tricarbolic acid. That's kind of the Fusarium indicator, and there's some of those toxins on the mycotox panels. But I think the water damage buildings and more the molds that tend to grow in water damage situations, primarily Aspergillus, Penicillium, Stachybotrys, I think those tend to be more heavy culprits than the dietary sources.
Yeah, I mean, that's my hunch just in watching people react to different toxic loads. What do you think the impact of EMFs, Wi-Fi is on these co-infections and on mold? I've heard some of Klinghart's work where he really talks about the frequency of Wi-Fi agitates these co-infections and makes them worse. Tell us I'm curious your thoughts on that. Wi-Fi personally is one of those things that I'm like, oh God, it's like mold. It's like, okay, it's damaging us and there's no easy answer, but people have to know about it.
Mm-hmm. Yeah, the EMF thing is really interesting to me because it is one of those things. I think like the EMF with all of the environmental toxicants that are just piling up day by day, like that freaks me out the most, right? Because, microbes and some of these, toxins and natural biological toxins that we've evolved with, like I trust that my body can handle a microbe here and there. What I don't trust is, can my body really handle that stuff with all of our more modern day radiation and toxins? So the toxicants and EMF is what kind of freaks me out the most. And we don't really have great data yet on any of that. Like we see some evidence of, non-ionizing radiation might stimulate peroxynitrite, and then that's causing oxidative stress and inflammation. I have also heard about Klinghart's theory about, does the EMF basically agitate the mold and cause it to produce more mycotoxins, which, then you think about it. And I will say, working with a lot of clients, I've observed that some of them do seem to be a little bit more EMF sensitive. I have no idea if the EMF actually irritates the microbe, but I think it's a good theory and it makes sense. I mean, I'm sure that radiation is doing something both to our cells and the microbes.
Yeah. So if you have an infection like Lyme or mold, would you tell that person, like, don't be carrying your phone next to you, or put it on airplane mode, or turn off the router at night. Like these are all things, these are like rabbit holes we could go down.
Yeah.
And we have an 18-year-old son at home, and I'm waiting for him to get out of the house so that I can start turning the router off at night. Right now, that wouldn't go over very well. And then your brain kind of goes to this place of like, do I really need to do that? You know, what is this just a hype? You know, what are your thoughts on some of those habits that people are doing, and especially for people who are dealing with co-infections?
Yeah, it's a really good question. And, you know, from personal experience, I definitely am concerned about the EMF and Wi-Fi. I myself, you know, I turn off my Wi-Fi router every night. I turn my phone on airplane mode, but especially with like, we all just started getting saturated in this new 5G. So
Yeah.
I think then, I think it's relevant. And I think assuming that the client or patient is ready, willing, and able to kind of take on more information and make more behavior modifications, you know, it's kind of that low-hanging fruit that we could try picking to help. But as you know, working with individuals, it's kind of all about priorities, compliance, attention span, accountability. So when it comes to priorities, you know, them turning off their Wi-Fi router, I think it could help, but it's like, it's a drop of water in the ocean. You know what I mean? There's so much bigger things that they should probably be doing. So I generally don't find myself consulting a lot on that. It's more, I'll provide that education, and it's more something that hopefully they just become more mindful of over time. But when they're actually really ill and we're trying to move the needle, it's not really a high enough priority for me.
Yeah, and it's really hard to do.
Yeah.
Like I brought on an expert, and he was talking about drapes you put in your bedroom if you're near like a power line. I'm like, oh my gosh, this would be amazing if you were super sick, and yet I can't picture the average person going after this and doing this.
Yeah.
What do you think? You've brought up some gene stuff before, and I want to talk a little bit about MTHFR and methylation, because again, we work with so many toxic people that you see some people who just have these huge toxic loads, and they seem like they've been doing okay managing it, and then like something tips their bucket. And then you see people with just a little bit of a toxic load, and they're just struggling. Is that because of poor methylation? Is that a MTHFR situation, or genes at play in that scenario?
I think it definitely can be a contributor. You know, I saw you had Ben Lynch on your show, and I'm a big fan of him also. Yep. That's how I got into all the methylation stuff. And so I do think it's very relevant. I think with the gene stuff, I mean, really, you start digging into it, and it's like, well, there's a SNP for everything, right? You know, there's
exactly.
You know, SNPs are what make us unique, right? Yep. So I think genetics and genetic testing and like SNP hunting can be just a distracting rabbit hole that takes away from maybe the more kind of pressing behavior priorities. But still, it is very relevant. And so, like, with MTHFR as kind of the most popular SNP, largely thanks to Ben, you know, even conventional medicine is starting to test MTHFR routinely.
Really? Ah, cool.
So actually, that's how I got introduced to MTHFR, was when my ex-fiance and I were trying to figure out what was wrong with her. First thing we did was go to our conventional healthcare provider, and they did some routine blood work, but they included the MTHFR gene, which I had never heard of. And all they said was, hey, this is a gene, it's related to neurochemistry. So we're going to compound this special nutraceutical that might help with your mental health. And that was it. You know, I didn't know that there was so much more than that. But what they're doing through conventional healthcare is they test the gene. And if you are positive for like 1298 or 677, you know, homozygous, whatever, if you test positive for the gene, they immediately will prescribe a megadose nutraceutical of like 15 milligrams of methylfolate, 15 milligrams methylcobalamin, which is like 15 times higher than what you would get in like a multivitamin. So it's kind of that classic, like, if some is good, more must be better. And of course, as we know, you know, genes are the blueprint, not the destiny. So I think it's kind of fallacious reasoning to you're looking at the blueprint without looking at biomarkers that are reflective of methylation status and then just doing this mega dose. But my point being, conventional medicine doesn't bother looking at anything unless it's very relevant, very scientifically validated. So I definitely think, if conventional healthcare is starting to look at MTHFR routinely, I absolutely think yes, we all need to be in tune with this, but again, there's so many SNPs for anything. So
right. Well, and my thought on that is that if we look at the microbiome, I know there's a lot of debates on this, and the study of the microbiome is so young and brand new, but they're saying we have like 100 bacterial cells to human cells, and that they influence the human cells. So there's a part of me, and again, I'm curious your thoughts on this, that's like, well, why even bother with the human cells if there's more bacterial cells and they control the human cells? Why are we obsessed with this genetic testing? Yes, it's cool and it can give us some insight, but let's just go to the source and start to work on the microbiome and see what we can do to bring that back into balance and then come back to the genes. Mm-hmm. What are your thoughts on that?
Yeah, I agree. I agree more so with that logic. I think the microbiome has kind of changed and disrupted everything we think we know about human health and medicine and even nature. And that's why I love listening to Zach Bush talk, because he's, kind of going even further upstream with it of like, okay, well, rather than just being obsessed of the human microbiome, let's be thinking about the environmental microbiome. And, ultimately, microbes are the building blocks of all life, the archaea and viruses and bacteria and fungi. So I like that he's more trying to zoom out and look at systems biology and looking at the microbiome of the planet, because then we will be, our microbiome will be influenced by that microbiome. But as far as more from a kind of individual sort of medicine standpoint, I think we have a lot to learn, but there's a lot of fundamental things that we do know. Like my friend Kiran Krishnan from Microbiome Labs is doing amazing work with really validating the science of, how the microbiome is impacting every facet of our human biology. So that kind of gets into the whole germ theory. And although there's absolutely a time for antifungal or antibiotic drugs, we are kind of just digging ourselves deeper and deeper into this hole that's already full of glyphosate. So I think we have to learn how to, care for the garden of life that lives within us, and subsequently care for the garden of life that is this beautiful planet. Yeah.
Have you seen Kiss the Ground?
I haven't, but I need to watch.
Oh, you got to see it, because so I started off my journey in nutrition trying to understand the gut, and specifically Candida, because I too had chronic fatigue syndrome, and it was Candida related. And actually listening to you today, I'm like, I bet there was mold, and I got it when I was in college. I lived in some old funky homes, and I'm like, I bet there was mold there. But for years in my practice, we focused on killing Candida. And then what would happen is it would go away, and then it would come back, and it would go away, and it would come back. And until we'd started to look at things like heavy metals and trying to remove the other sources so that the body could take care of the Candida on its own. So that's where my brain has been for the last 20 years. And then I've been through just so many conversations with Zach and Kiss the Ground. I've started morphing into this feeling like, oh my God, if we want to get the human body healthy, we're going to need to get our planet healthy. Mm-hmm. And we can all argue about climate change or no climate change. But what I love about what Zach and Kiss the Ground is saying is let's just go back to soil. Mm-hmm. What is in our soil? Do we have nutrients in our soil? Do we have microbes in our soil that are helpful? And how do we bring back the health of our soil? What are your thoughts on that, this interconnectedness of the human body and the planet's health? Do you feel like we're coming to an understanding that we are really intimately intertwined?
Absolutely. I mean, the fact of the matter is we are the only living species on this planet that's living dysbiotically with the natural world. So, I don't think it's any great mystery of why we're walking closer and closer to extinction as a species. And that's, as much as I love science, I think science is so myopic and dogmatic
Yep.
at times. And I think we can't really afford any longer. I like to think we should lead the science with intuition and let the science validate our intuition. And I feel like we as a collective have just totally lost touch with our divine intuition, our interconnectedness with the planet. So we do. I very much inspired by Zach, but I keep saying, we have to return to symbiosis. Like that is the only way forward. And all we're doing is harvesting the goods of the planet for our own kind of egocentric desires. So we need to figure out how to, as Zach says, be co-creators with Mother Nature. And we have a long ways to go with that. So
yeah, go watch Kiss the Ground because it gives you some hope. It like walks you through it, and then it gives you something to do, which is amazing. You talk about the leaky gut and like how leaky gut like affects leaky brain or affects the brain health. This is another topic that has fascinated me because when I look at leaky gut, the first thought I have is glyphosate. It's the number one cause of a leaky gut in my book. And please let me know if you think beyond that. I'd love to hear what you have to say on that. And then I really think we've understood that the gut controls the brain, but the brain also controls the gut. So can a toxic brain create a leaky gut, or does the leaky gut create the toxic brain?
Well, I think like any axis, it's kind of that chicken or the egg of, I think it's both. I think they feed into one another quite a bit. As far as like the mechanisms, I think it's more about, the gut becomes leaky and then the brain becomes leaky. I have a harder time seeing mechanistically how, sort of a toxic brain would work the other way so much, but the mechanisms of that GI barrier and the blood-brain barrier are really pretty similar. The glyphosate or the LPS or mycotoxins or all these things. So, for example, the kynurenine pathway. And so two markers I really like to look at for, trying to get some pulse check on the blood-brain barrier and all of that would be like quinolinic acid on an organic acid test, or then the MMP9 marker I mentioned on blood chemistry, because both are associated with the degradation of the blood-brain barrier. But I think really, glyphosate, mold, LPS, any kind of bacterial, fungal, I think there's a lot of things that probably perpetuate that, but I am inclined to believe it more starts as a leaky gut than into a leaky brain primarily.
Yeah, and that's kind of the school I've come from, and for like 90% of the cases, and then I'll get like somebody who's really constipated or has like SIBO, and we're throwing everything at the gut, and then we go up to the brain and we start pulling toxins out of the brain, and the gut heals. And I'm like, oh, yeah, that's right. They're a pair of organs like the heart and lungs. Like we've got to look at them together. So it's fascinating. This is what's fun about what we do.
Absolutely.
What do you think glyphosate's the number one thing causing leaky gut, or do you think all those other things you mentioned have equal relevance?
I think that, we see that glyphosate, and then, even there's some pretty strong evidence of gliadin stimulating the zonulin protein and all of that. And I think we have a lot to learn about zonulin in particular, and some of those mechanisms. And I am inclined to believe that there must be some reason why the body, activates and inducts zonulin and kind of open. I think there's something to that. Maybe it's trying to present the immune system with an antigen to create an immune response. Mm-hmm. I don't know. But yeah, I think like glyphosate is a major one, but mycotoxins can, LPS, and basically everything about the standard American lifestyle creates this standard American metabolism, standard American gut. But I do think like the glyphosate, the mycotoxins, the LPS, maybe gluten. I think gluten's a culprit, are kind of the biggest inducers of leaky gut.
Yeah, the modern world.
Yeah.
Like again, I go back to like the modern world that we walk into a grocery store and we just assume that everything that's in there has been vetted and researched and is okay for us. And it's not.
Yeah.
This is like the biggest myth that I think we have right now, is that all food is created equal, and it's not. This wakes me up at night. I hate it. So what are your thoughts on autoimmunity? Because I know you also talk about that. Do you feel like on some level everybody's got an autoimmune condition going on right now?
Yeah, I'm inclined to think that there's a lot that we don't know about autoimmunity, and the more that we dig into it, kind of seems like just about all conditions have some sort of autoimmune component to that. And we love to dig into the balance of Th1 and Th2, Th17, and trying to, how do we balance that so we don't get too autoimmune or whatever. But ultimately, I think if we can return symbiosis and remove all of these triggers that do cause. So, the bystander effect and molecular mimicry and some of these theories of autoimmunity, I think are great. I think we're onto something with that. I think we kind of oversimplify autoimmunity in the functional world of sort of, well, it's as simple as you have leaky gut, bad things are getting through, your immune system gets confused, your own tissues kind of get caught in the crossfire. That's sort of like the narrative that we're saying. But I think we just don't fully understand, because that's even where, like, we love talking about parasites, but then there's research to show that parasites might actually have a positive immunostimulatory effect. Or, there were studies where, well, when they treated this population with whatever drug and eradicated, this bug, well, then their immune systems became overactive and started attacking their own tissues, and autoimmunity went on the rise. So I think if we can kind of dismantle some of our modern toxic behaviors that are just causing this, chaos of physiology, then we might have a more clean slate to actually be able to start studying autoimmune mechanisms to get a grasp on this. So yeah, I think autoimmunity is kind of its own pandemic and epidemic, and it's so common.
Yep.
I think it would be like second to cancer if we added up all the autoimmune conditions. So yeah, it's a huge one for sure.
Yeah, and again, I'm going to go back to modern living. There's something in our modern environment that is causing everybody's immune system to be so mixed up, and I think the gut is like such an important place to come to. Some of the most popular podcasts, two of our most popular podcasts, I'll say, of all time, have been around the carnivore diet. Have you followed any of the carnivore diet stuff?
Yeah, I kind of keep tabs on everything that's going on, and carnivore has popped up, fasting's huge right now. So there's a lot of kind of these specialty dietary strategies that are being played around with out there.
Yeah. So I'm curious, because one of the cool things that we've done is we've got hundreds of thousands of people on across our communities where we do these fasting experiences once a month. And so in July, several of my friends in the health influencing world have been talking about the carnivore diet and how it really is great for autoimmune conditions. And for me, studying the microbiome and it's a huge fan of Zach Bush for so many years, I was like, there is no way eating meat all day is going to help an autoimmune condition. But I got to tell you, we rolled out what I call carnivore fasting, where people fast for 17 hours and then all they do is eat meat. And it was insane. People with autoimmune conditions, especially the joint pain, the aches and pains, that went completely away. And like quickly, like it didn't take, like somebody with RA or lupus, like just gone in the matter of days. Do you have any explanation? I've talked to Dr. Paul Saladino, I've talked to people about it, but from a leaky gut perspective, do you think it's because meat isn't sprayed with glyphosate? I don't know if that's proper logic, but why do you think that could even work?
I think it's a really interesting discussion. I think fasting by itself is just huge. And it's, I don't know, I think humans are very disconnected from, again, our kind of primordial intuition. So, it's like we need studies to validate what
Right.
maybe should be good common sense. Like, have you heard of that new diet where you just sometimes don't eat? Like, what a novel concept, right? But with that facetiousness aside, I do. I think fasting has amazing science coming out about it, whether it's upregulating autophagy, which I think, to your point, might be kind of one of the main mechanisms there that's helping with the autoimmunity is, we give our body a break so it can actually heal you can't, it's kind of like when you're driving a car, you can't really fix the car while you're driving it. So it's
such
like
a good analogy. That's
right,
really
like,
good. Yep.
let's maybe take it into the shop so we can give it a break and work on it. So I think when we fast, we do give our digestive tract and mucosal membranes and enterocytes a chance to actually recover, and we're inducing autophagy so we can clear out some of those old damaged cells that maybe those are eliciting sort of an autoimmune response. The body might be trying to clear some of those out. So I think fasting by itself is one of the major things. As far as carnivore, I think mix. I could see how, like, carnivore or keto, whatever, a little difference there, could potentially have some favorable effects on the microbiome and the intestinal lining. I don't know about long term, because I think, it is our plant foods that give us a lot of the polyphenols to feed the diversity of our microbiome. So I don't know if it's like a long term, but I think especially with the standard American gut, or kind of modernized gut, that's so damaged and dysbiotic and highly fermentable and whatnot, I do think maybe if we gave it a break, we stopped feeding those, opportunistic pathogens, maybe it's giving our body a chance to kind of clear that out. And then we could kind of reintroduce our fibers and polyphenols to, feed diversity. So I think keto and carnivore and fasting can be a very effective break to clear out toxins, clear out unconstructive microbes, so on and so forth.
Yeah, it's like my theory is, like, when in doubt, fast. Like, there's an intelligence inside of you, and when you don't know and the doctors don't know, start fasting, because the intelligence knows. And do you think that we as humans are completely disconnected from this intelligence, this inner healing? We have such a fascination with medication and all the cool and surgeries. Do you think that is causing us to be more disconnected from our own internal healing power?
Oh, absolutely. The psyche conversation is kind of a whole other conversation, but I do feel like our collective psychology is getting increasingly toxic, which just causes that negative downstream effect in signaling. So I think we have to relearn how to trust ourselves. And I don't think, especially the events of this year, has increased our trust in ourselves or one another or governing bodies. So we have to realize, like, our body has our back if we take care of it. We have to give it what it needs, and it will take care of us. So we have to have a little more faith in this amazing meat suit that we were born into.
Yeah, I always tell people, like, if I drove a Lamborghini into your driveway and I parked it there and I said, "Hey, this is yours," you would probably be in such awe and take amazing care of it. Well, that's what you were given in your body. You were given the greatest sports car, the incredible machinery. It's just that nobody left you the manual, and everybody in your life has told you that health is from the outside, has to come from the outside in. And this is what I love about fasting, is I can take the most dubious person and I can take food away from them, and they get this, like, mirror of, like, oh my God, my body can do this.
Yeah.
And I feel like we're just so disconnected from this internal healing, because we feel the hero of the day is the doctor or the medication or the surgery. We forgot that we're actually the hero of the day.
Yeah, I couldn't agree more. And literally just today I posted to social media kind of posing this rhetorically of, are you chasing your root cause, or are you running from your unresolved trauma? And I think the root cause paradigm is very seductive. I think it's better in theory than application. And I think a lot of people are, really kind of chasing like, oh, well, this is my root cause and that and this and that. And they're avoid facing themselves. They're really avoiding facing those more challenging kind of existential crisis type questions. So I always do think, healing starts as a choice of the self, and we have to look within before we, look outwards. Absolutely.
Yeah. Yeah, I couldn't agree more. Now, what I find interesting about your path is, so as we evolve as practitioners in the health world, each of us sort of have our own mission and desire. Mine for me is like, I just want to reach the lay person and like get that person to believe in themselves again and like give them the tools. You're on a mission to train doctors. Is that right?
Yeah, so my business really focuses on training professionals because I love this industry. I really do. And with that, I believe we can do better. I think we can improve the efficacy of what we're doing in all aspects. I think a big thing I want to try to do is really bridge that gap between like the health coaches and the clinicians. I think we all need to work together. I don't see as many doctors that know how to be an effective coach and help implement actual behavior modification. But obviously coaches can't diagnose, prescribe, treat. So there's a huge gap there. And I really hope to close that gap a little bit.
Awesome.
And so that's kind of like my day job. And then sort of my, bigger passion is trying to help the world with their mental and metabolic health and just pouring free content out there. So mental health is kind of a particular area of passion as well.
Yeah. Do you know Dr. Kate Shanahan?
I don't know that I do.
Oh, she wrote a book called The Fat Burn Fix, and
Okay.
she's a family physician. And one of my passions with my YouTube channel, I put out all the science on fasting out there and educate people. And what we're seeing are more and more medical doctors are coming to the channel and they are like looking at the science. I link all the science in the notes so that we can speak each other's language or speak their language because they have that on such a pedestal. And so I asked her, I'm like, give me some insight. What did you learn about nutrition in medical school? And she was like, nothing, nothing. She goes, they're still teaching that saturated fat and sodium is the root cause of heart disease. And one of my missions has been like, I see a world where we just all come together and bring all of our collective information and our willingness to help people and try to figure out what's making the human body sick right now and that we can collaborate. Do you think that could ever happen? Like, I love, like, you're like, I want to bring the doctors and the health coaches together. It's like, I want to bring the AMA and all the rest of us together so that we can show up in this way that will support humanity. Do you think we could ever do that?
I do. I genuinely believe we can. I think we're in the midst of a big awakening. And, we are, it's like Zach Bush talks about that a lot. Like, we are kind of running out of time. We need to get our stuff together. Yeah. And, I don't think there's no room for ego or scarcity mindset or any of these toxic behaviors. Like, we need to check all that at the door and start working together. The thing I love most about our industry is the diversity. It's professionals of all backgrounds putting their heads together of how can we more effectively participate in the collective healing of humanity. And every professional has a place, whether they are a medical doctor, chiropractor, dietitian, personal trainer, health coach, doesn't matter. Everybody brings something unique, powerful, and different to the table. And I think we can all work together to really evoke something beautiful.
Yeah. No, I absolutely agree. And that, I do a meditation in the morning, and that's like one of the things I visualize is like, and this year, you're right, has been the year that has really reflected back to us that we're trying to outrun this virus in a very broken healthcare system. Yeah. And just like all these other systems that we're seeing bubble to the top, we have like a really broken view on health. And if we all came together, oh my gosh, the human body would win. It would be incredible. So let's finish up with this thought. So, and thank you for letting me pick your brain. Like,
Yeah.
I'm just like one of those people that sometimes questions get stuck in my head and I can't get them out. And I love bringing experts like you on and like hearing your opinion and hearing how you're putting it into action.
Yeah.
So let's do so here are 5 questions made specifically for you. My first question is, if you could go back to your younger self, go back to the guy that was about to start Navy SEAL training and give him some advice, it could be on life, it could be on health, what would you say to him?
I'd say lighten up and stop taking yourself so seriously.
Yep. We've had a couple people when we ask them questions similar that say the same thing. So interesting. What are 5 things that you do on a regular basis to support your health that you're never going to stop doing?
Oof. You know, I protect my sleep like none other. I'm such a baby. You know, it's 8 o'clock getting to be my bedtime. So my sleep is a non-negotiable. My workouts and yoga, my nature walks. Gosh, what else? Honestly, just having time alone to be able to decompress and recharge, look inwards and introspect. You know, these are just some of my daily practices that allow me to put my best foot forward and show up at my best so I can actually, you know, serve humanity. So,
Agreed. How much sleep do you think we need?
you know, the 7-9 hours, it works. Some people a little less, some people a little bit more. I'm a more kind of person. I like my 9 hours. Anything less than 8, and I'm not feeling so hot. So
Yeah, awesome. Do you track your sleep?
not really. You know, there's so much going on up here all the time that sometimes like tracking data just becomes a little bit noisy. I think the Oura rings are really cool. I think HRV is really handy technology to kind of get a little bit more in tune. You know, I like to think that these gadgets, or whether it's food logging or HRV, whatever it is, I think the goal should be to use the external data to reconnect with our internal biofeedback and you know, signals that the body's trying to communicate to us. So I try to be very in tune and intuitive with listening to what this needs.
Yeah, I had the Oura ring for a while and then it stopped pairing. So I'm trying to figure out why it's not pairing. So we're trying in my office the Whoop band.
Yeah.
And yeah, it's awesome. And you can get a little obsessive about it. And then then I have a competition with like myself from yesterday. And I'm like, okay, what can I do to like better that? And so I like that. But then you can get a little obsessive about the information and lose sight of the intuition that you need to tap into.
Yeah,
so,
exactly.
but they're awesome. Okay, if you could pull one toxin out of the environment right now, what would that toxin be?
I mean, it would have to be glyphosate. There's no doubt about it. That's the most prevalent, the biggest, the most problematic, I think. So hands down, glyphosate.
Yep, I would agree. Okay, fourth question. What mentor or which one of your mentors has had the greatest impact on you?
That's a good question. You know, I've been really privileged to be connected to some amazing figures that I'm just so deeply grateful. The top 3 that come to mind would be my friend, Dr. Carrie Jones.
We love Carrie.
Yeah,
I brought her on. She's great. We connect on Instagram a lot.
Yeah.
She's doing great stuff.
Oh yeah.
Like she educates. If you guys want hormone information, go find Dr. Carrie Jones on Instagram because she is relentless with providing information.
She was like the first figure that I really befriended in this industry, and she's such a great ambassador and role model and such a kind, caring person. So she's high up there. And then Karan Krishnan with Microbiome Labs, he inspires me so much. Zach Bush inspires me. But as far as kind of more of a direct mentor figure, my professional mentor is Dr. Brian Walsh, who he chooses to kind of fly off the radar. You know, he intentionally disconnects a little bit, but he's such a wealth of knowledge, so humble, and knows physiology and science unlike anybody I really know. So he's kind of my mentor, but those are some of my other inspirational figures.
Awesome. Awesome. I love it. Okay. And then my last question is, if you had one message for the world that you could get into everybody's brain, what would that message be?
That's a tricky one. That's such a big one.
It is.
And I think primarily it's one of those, you have the power to heal yourself. Like, and you've got to look within. Like, whatever it is that you're looking for, you're not going to find it out there. You're going to find it inside. So look internally first, I think, is my main message.
I love that. When we ask that question, that all of our guests get asked that one, there's two very common answers. One is it's all about love, and just come back to love. And the other one is what you just gave. You gotta start to believe in your own healing again. Yeah. And I think that if we actually want to take a series of everybody's message and put them together, because to your point, we're more similar in what we're trying to accomplish on those of us that are stepping out into the world of social media and trying to get education out there. There's a common theme that goes through all of us. And when you start seeing all the different platforms, you see that theme. So, and You're Powerful is a big one.